Good morning, everyone. Welcome to the Health, Wellbeing and Social Care Decision Meeting. I'm Councillor Matthew Whittington, Cabinet Member for Health, Wellbeing and Social Care. Just some housekeeping first. If the continuous fire alarm sounds, please evacuate the room and the public gallery via the stairwells. Do not attempt to use the lifts. Assemble the Queen Victoria statue at the front of the civic offices. And in order to comply with the Portsmouth Cultural Trust Fire Marshal regulations, please remember to sign out when you leave the building after today's meeting. This meeting is being live web streamed from a fixed camera at the back of the room, and this will be recorded and be going out on the council's website. We haven't got any deputations, so I won't mention about that today. And if there were members of the public here, they could record the meeting. Lastly, just a reminder, could everyone use the microphones provided while speaking? So, I'll formally start the meeting now. So, apologies for absence.
Yes, Councillor George Fielding.
Thank you very much. And only got Luke here as member. Any declaration of interest, Luke? And I haven't got any either. So, first report we have is on adult social care bandings. Andy, could you present the report, please?
Thank you. Good morning. So this report is to provide an update on the proposed strategic direction for adult social care, how this relates to the service working toward achieving financial balance, and the impact of requests that have gone through the job evaluation questionnaire process relating to posts within adult social care in relation to the financial strategy. I've outlined on paragraphs 3, 1 and 2 on page 1 some of the context around adult social care, both at a national and local level, and some of the strains and challenges that currently face adult social care, and those have been well reported in the national press in recent years. And in Portsmouth, we've been working towards a strategy to ensure that we meet those challenges and to have some confidence in meeting the financial implications of those challenges over the next 2 to 3 years. The ways that we're proposing to do that are to consider how we use enabling technology that can do things for people, whether this be by offering advice and places where people can purchase for themselves, or whether this be through provision, direct provision, and providing response and responding services in relation to that, and thinking about a technology-first culture with every contact that we have for people with care and support needs. Moving on to the second page, the other strand, or one of the other strands of our strategy, is to consider the control people have over services, how services are generally personalised, and think about resources in individual communities in Portsmouth. We know we've got a very vibrant volunteer and community focus throughout the different communities in Portsmouth. And we believe that we can tap into that and help people understand what's going on their own front door, which could meet some of their needs, in addition to any statutory needs that the council's obliged to meet. We want to have a focus on reablement services that work with people to help them come to a level of independence rather than do for or do to people. And that ensures that people get help at the right time and may need a lot of help in a crisis, but that we're planning out of that crisis with people to move towards a level of independence and help them to access their own resources wherever those are available. We want to think about how we provide supported living. We're already quite fortunate in Portsmouth. We have a lot of places where people have their own front door, but they have care on site. And we want to think about how we work with people with a dementia and younger people with a mental health problem, a long-term mental health problem, to change the balance of what we have currently in terms of people going into residential care, and that will be within the next 2 or 3 years. And we also have a role to improve service quality in the care sector in Portsmouth. There's a number of providers who receive a Care Quality Commission rating of requires improvement, and we have formed a quality team between ourselves and the Clinical Commissioning Group to work with providers to help them look at how they move their quality of service up, and also the interest for providers themselves and to think about how that affects their ratings with CQC and therefore their business. So those are 5 of the main strands of our strategy over the next 2 to 3 years. And we believe that that will help us, as well as being the right thing to do, we believe that will help us address our financial deficit that we came into this financial year with and we're predicting for future financial years. By reducing the length of time that people stay with us, by thinking about resources that people can access that aren't necessarily statutory resources, and by helping people to be more independent, which fulfils the principle of well-being that was brought in under the Care Act of 2014. The other issue contained in this paper is, as a result of savings made in adult social care in previous years and changes in our workforce, some staff have been working at a higher level on a consistent basis, and a number of issues related to pay and banding have arisen within adult social care. I've segmented that into three areas. The first is talking about caring for people with their own homes who have increasingly complex needs, and responding to regular changes in legislation or case law that we see, particularly in relation to the Mental Capacity Act and deprivation of liberty. And we're, within the next 12 months, about to see another change to that, as I understand it this morning. And so that's made it increasingly complex environment in which to practice in terms of risk assessment, ensuring that people, as the law guarantees, have the right to make unwise decisions, but also ensuring that the council is accountable for what it does and makes every reasonable effort to help people safeguard themselves and to safeguard people. That also relates to the same job, families and children's social care, which have been changed recently in terms of their banding. In our day services, we provide day services for people with learning disabilities directly through the council in Portsmouth, and we changed that model a couple of years ago to reduce our reliance on independent providers outside of the city and keep people with quite complex needs in the city. At the time, we rebanded our support workers downwards, and they were granted protected salaries for 2 years at that point. The other issue is our change in our client record system. The electronic system that we currently use to record all of our contacts, all of our financial commitments, and anything really to do with an individual that has care and support needs, and we'll be able to support in 2020. And the decision's been made to work to replace our system with System 1, which is also a system shared across GPs and Solent NHS Trust colleagues in Portsmouth. We have a critical point of failure in that we only have one specialist management information officer working currently producing our reports and data that go nationally to NHS Digital, and local reports and data that are used locally to shape and focus services. And that role will change significantly with System 1 and be far more fundamentally involved with shaping the data, interrogating the data and understanding what we need to submit, and then using it more actively at a local level. So as a result of those three things, we've had requests for job evaluation submitted by those three groups of staff. In 3.6 on page 3, I've outlined the way that the City Council relates to wages, relates to staff wages, uses a nationally recognised job evaluation scheme. So the process in that is that staff believe their role has changed, they complete a job evaluation questionnaire, a manager reviews it and says, yes, that looks pretty much what you do at this moment in time, and then that goes forward to a panel independent of the service for a decision on whether the banding has changed. Some of these posts, the Felt Fair panel has agreed that they have changed and have given us a result on that, and some of these posts have yet to go forward. So at 3.8, I've listed the moderated bandings that we have either been agreed or we expect to be agreed based on information fed back to us. And those are for independent support assistants, main grade social workers, higher grade social workers, Portsmouth Day Service support workers, and the management information officer. I've highlighted that the impact, the budgetary impact of that will need to be considered as part of our financial strategy that I referred to earlier. And on 4.1 on page 4, that the financial impact of those changes is in the region of 108,000 in the first year for the 88 staff, 77 full-time equivalents within those affected posts. And we've also highlighted there, as we progress in future years, there'll be a total burden on our finances of 281,000 over that 5-year period. That accounts for people moving up and down within their increments, depending on an April increment, and pay rises, and that we'll need to meet those increased salary costs from those changes that we've outlined in our strategy. And that's the item for information. I'll take any questions.
Thank you, Andy. Just a couple of things. Could you just confirm that the job evaluation that staff have a right to do that at any time about their jobs?
Yes, they do. The job evaluation policy is set on the Council's Policy Hub, the internal mechanism that we use to store our policies, and it's initiated by staff. The role of the manager is very much to look at what staff have submitted and say, yes, that is a good approximation of what you do, or no, it isn't.
Thank you very much. And just the other thing was, you mentioned that a couple of the posts of the posts there have not been through Feltfair yet, and if it does come up that it is different from in this report, what will happen?
I would propose to put an MIS announcement through to inform democratically that everything isn't according to the report I put through, if that was acceptable to the council.
Okay, thank you. Yeah, that sounds a good plan. Councillor Stubbs, do you have any questions?
Well, that's as much a comment as a question, if that's okay. I mean, I obviously do understand that bandings have to be consistent across the organisation. I mean, I read this almost the same way we upgraded all the children, so we have to upgrade all the adults as well, and that kind of gets into a bit of a upward spiral, and the problem with that is that the budget doesn't go up. So, you know, this year the adult social care budget is going to be flattered somewhat by a one-off £500,000 grant, adult social care grant. But have to remember that whatever the position ends up being at the close of the year, the underlying position is £500,000 worse. And therefore, you know, it is, I mean, I'm concerned about, you know, staying in budget here, and whether it will be possible to identify what's going to have to be an additional £281,000 of savings in order to make this stack up. I think it's going to be very difficult to do that. Equally, as an authority-wide level, we can't afford just to add more and more on to overspend, so it concerns me. But I do appreciate, as I said, that staff have to be paid on a consistent basis.
Thank you very much, Councillor Stubbs. Just a few more comments from myself. I think that, as Councillor Stubbs just said, I do think we have a duty to do things, pay staff on a consistent basis, and also I think the fact that it is a staff-led initiative that they put forward, that they think they're, and that is the policy of the council, has been for some time. So I do think if staff have gone through that process, we have to honour that process. Whether in the future we would do a full look at the whole of the service, that's something that we've got to decide whether we do. But at the same time, obviously, what you can also go down as well as up. So I think we have to be aware that that may be the case for some people. As we see, even within the reports, we've had some people who've stayed that we are expecting or are staying static. So despite the fact they think they've gone up, they've actually stayed the same. But I am grateful to officers for putting out within this report about the future financial, the way we're looking at making savings through the way we work differently. I'm particularly pleased with the part about working outside of silos with our partners in the city, including with the CCG, and also I know that we've had quite a lot of discussions about working across departments as well, and also the fact that we are actively pursuing options for better, more appropriate extra care for people with dementia in particular, and we're working on possibilities of new places for them to live and stay, which will be something that I will be really keen to happen, because I think that can not only make a better life for our people in the city, but also can make savings as well, because you're getting the right level of care for the right level of people's needs. So thank you very much for the reports. Happy to note that, and yeah, thank you. So we move on to agenda item 4. So it's the Harry Sotnick House transition update, and I believe Richard is going to take us through this.
Yeah, thank you. The purpose of this report is to provide an update on the financial arrangements in respect to the operation of Harry Sotnick House Nursing Home, following the decision by the Cabinet member made at the meeting on the 7th of March. It's a short update. There's no decision required in relation to this paper. Happy to take any questions you might have.
Okay, thank you very much, Richard. Can you just, so in the report, there is a, we've got the 3.4%, 3.4 million pounds in year 1 and 2.4 million in year 2, and an additional cost of service in this period of about 3 million. Have we got, within the reserve that we have we got the ability to cover those costs?
Yes, as I highlight at paragraph 3.3, the Council has made provision to meet these costs over this period.
Thank you. Councillor Stubbs, do you have any questions or comments?
Well, I was only going to ask something about that, really. And so you've got 3.4 and 2.4. Is the expectation that the ongoing, year 3 and onwards is going to look something like 2.4?
Currently, the modelling shows sort of the expected level around that 2.4. As I've highlighted in the report, there are a number of initial assumptions as the transition to the operation by Hampshire has taken place, and we'll be reviewing and updating that model as we progress and work with Hampshire to identify the most efficient operating methodology.
Thank you, Councillor Stubbs. Yeah, just other than that, happy with the reports. So happy to note that, and that concludes the formal part of the meeting. But it would be remiss of me to say that obviously today, and this is as is the Health, Wellbeing and Social Care meeting. This is the 70th anniversary of the NHS today, and all of us have an enormous amount to thank the NHS for, not least from literally from birth in most cases, if not every case. So therefore, I would ask you to join me in wishing the NHS a happy 70th birthday with a rendition of Happy Birthday. So, on camera, yes, come on. So I want everyone singing. So, happy birthday to you, happy birthday to you, happy birthday dear NHS, happy birthday to you. Thank you very much, and happy birthday NHS.